and I'm happy to present our laboratory work based on nanotechnology treatments for cancer therapy. So here you can see a various cover art work of our various concepts based on nanotechnology that has been applied for cancer therapy. Lately, we have also been involved thinking about COVID, how we can make a better nanotechnology strategies for COVID. Also, you can see on the right-hand side, two of the latest of our work featured on cover pages. One is on bioconjugate chemistry and another one is on ACS sensors. ACS sensors is the latest one that was featured just today on their journal based on CRISPR Cas9 based detection for the COVID. However, today I'm going to more focus on cancer therapy, how we can make a better therapeutic strategy or imaging technology using nano-based methods. So my team focus primarily involved on cancer, particularly from the prevention aspect to therapy and also imaging, diagnosis, and theranostic applications. Apart from that, our team, our group is also involved developing a strip-based rapid test developments for cancer and also for COVID recently. And we have also discovered many other nanotechnology-based or nanotechnology-driven immunotherapy as well as imaging and diagnostic modalities. And you all might be knowing what nanotechnology means. So it's simple that anything, the material which is like 1/1000th of a meter in the dimension that we consider as nano-based material. So it is important to know that nanoparticles are not bigger than atoms. So otherwise, like many people think that nano means like even smaller than atoms. It's a wrong concept, that many people have in their mind. So nanotechnology in terms of dimensions, you can clearly visualize. So small molecules such as glucose has 10 power minus 1 nanometer, and you can scale up the various materials from protein, virus. You can see the increase in the dimension, its dimension in the size range of 1 nanometer, 10 nanometer, 100 nanometer, and you keep going. You can see the cell size is like a couple of microns, from 5 micron to maybe it could be 20 micron depending on the cell type. So where you can see various nanomaterials, those are lying from 1 nanometer to 100 nanometer. So we are many agencies based on FDA or maybe other NCI of ESA. So it strictly describe nanomaterials whose range from 1 nanometer to 100 nanometer. But often people refer these nanoparticles even if they are 200 nanometer or a little bit over. So nanotechnology is involved in various disciplines, not only in the research, but also in the application oriented in chemistry, physics, engineering, and biology. You name it, all the places you can apply. Even in civil engineering, you can apply. On your right-hand side, you can see the various basic applications of nanotechnology, right from drug delivery and nanoelectronics, and also from creating a more stable or more strengthened concrete that we can impose using some of the nanotechnology. Not only that, you can see many other novel detection methods that have been derived from various nanotechnology or nanoparticles. Today's topic is primarily devoted for cancer therapeutics or cancer imaging applications. So here you can see the statistics of cancer, particularly I focused for United States, where you can see close to 1.9 million every year diagnosed by various type of cancers in the United States. At the same time, 630,000 people die because of various type of cancers. So you can see how many ways that we can rescue the cancer patients, right from prevention aspects, screening, diagnosis, and treatment stages, where we can rescue these patients, by introducing some type of therapies or some type of screening methodologies or early detection methods. So I want to discuss like more of nanotechnology based, how we can use in all these areas, right from prevention, diagnosis, and treatment. And if you talk about delivery aspect, like you all might be knowing, many good molecules that show anti-cancer activity, mostly those are either they have low bioavailability or low solubility. On the other hand, maybe they are very hydrophobic, so that you won't be able to administer them as such unless you provide any stabilizer or you provide a good delivery vehicle. Even if you use a good delivery vehicle, you often see either low targeted delivery of those therapeutic agents at the tumor sites. And apart from that, you might also see the drug resistant issues when you keep administering same drug again and again. So meaning that these tumor cells are very unique or maybe very smart in nature, that if you give the same type of drug to those cells, maybe in the beginning they take some of those drugs and they may be responding to those therapies. Later on, they change their path of mechanisms. Maybe they throw out these drugs from the cancer cells. Therefore, you may not experience the effect of those therapeutic agents again and again. So to overcome these and also to maintain a minimum effective concentration, maybe it is better to use some delivery agents. So earlier, people have been used or still using small molecules, binding molecules with the drug, and then they improve the bioavailability. Later on, some type of polymers. And nowadays, people have been implementing various type of natural as well as synthetic polymer or other nanotechnology based agents. They can improve the therapeutic efficacy and delivery. And here I listed some of the commonly used drug delivery nanocarriers, and some of them, they act themselves as a imaging agents. It could be for MRI, or it could be for enhancing the contrast for a CT, or maybe it could be good for topical delivery, or it may be better for intravenous or ocular delivery, and you name it. All these type of drug delivery carriers can be applied for wide variety of administration purpose to the human as well as for animals, and also for some of the model that you can test prior to go for clinical studies. So here you can clearly visualize various group of nanocarrier. They fall in different size range. For example, take dendrimers, metal oxide, or magnetic nanoparticles. those are very smaller in size from 1 to 10 nanometer. And where you see nanogels, polymeric micelles, or polymeric nanoparticle, they may have mostly in the size range from 10 nanometer to 200 nanometer. Similarly, you take other types of nanoparticles, you can create them in different range from 100 to 300 nanometer, whereas microgels or microparticle, you can make them up to half micron to even 1 micron. So why it is needed to learn this size range means those are the ones that you can predict, which size of nanoparticle might be better to choose for a given delivery application or given cancer conditions. So once we know it's, we can make the particles with a different size range and also how we can administer them. The next most probably important factor is stability of these nanoparticles. Since they are smaller in size, they have more tendency to aggregate. So once they aggregate through these van der Waals forces or magnetic dipole-dipole interactions, the particle size is going to be larger and larger. Therefore, they may have tendency to precipitate. Therefore, we might see a low bioavailability or intended targeted delivery going to be poor. So considering that, it's always we need to keep in mind how we can better stabilize these nanoparticle formulation so that we can achieve a better and meaningful delivery aspect with the nanotechnology or nanomaterials. And the next important factor is going to be if you are using for drug delivery or imaging delivery or any other bio macromolecular delivery, its release is going to be a key factor. So depending on the application, either you can choose a material that can be giving you a diffusion characteristics of release, or it could be a burst release using a quick degradation of various means. And also, once we have these nanocarriers embedded with various therapeutic agents, that can be a stimulative means. That means you can ask them if you use any pH sensitive or any redox sensitive or temperature sensitive, so that you can ask their better or quick release given environment, taking the advantage of the local or tumor microenvironment. In the case of condition, there are two important things that we all need to remember, that these nanoparticles, primarily they target the tumors using a phenomenon called passive targeting, that is nothing but facilitated through an enhanced permeation and retention effect. That you can see on the left-hand side, bottom of the slide, that when you see these gold type colored nanoparticle, they are intended to circulate in the blood circulation. And when they see leaky vessels that are present near or in the tumors, these nanoparticles go inside these two tumors and then they lock up in the tumors. Therefore, they may release with the time these nanoparticle containing drug, and that therefore you might see some of the therapeutic benefit compared to small molecule drugs. Small molecule drugs, even if they go through this EPR mechanism, but they may have tendency to come out from the tumor cells. Therefore, you may have low therapeutic concentration at the tumor site. On the other hand, the nanotechnologies have favorable delivery option using a active targeted moiety based, or if you know that tumor cells are expressing some kind of proteins maybe you can deliver these against to those proteins so that these nanoparticles effectively go to the tumors and then lock up, bind specifically to those ligand receptor mediated binding or maybe antibody antigen binding methods. They can go on more specifically target to those tumor cells, and therefore you may have more amount of drug or imaging agent is going to go to the tumors. So these are the two main mechanisms, how better way that we can use this nanotechnology to deliver the payloads at the tumor site. And this is the one slide that will tell us everything about nanotechnology in terms of delivery of agents to the tumors more effectively, that we can, while we are making the nanoparticles, you consider all kinds of its physicochemical properties in terms of like what size range you want to make for a given application and what type of charge, either you want to have a negative charge or positive charge, and how these nanoparticle rigidity, surface hydrophobicity, philicity, and whether we want to apply magnetic or other optical properties that are originated from these nanoparticles. These are all you can keep in mind when you want to choose a raw material that you want to make a nanoparticle formulation. Not only that, if you see the chemical composition, that could be either a polymeric base or maybe a highly degradable, or it could be a just self-assemblies, or it could be a polymeric micelle, or it could be even, the viral based vectors that you can also apply for delivery or, vaccine applications. And apart from that, carbon nanotubes as well as hybrid based nanoparticle formulation can also be chosen for delivery of therapeutic agents. And as I said before, if you can choose a targeted moiety and selectively that you can put it on the nanoparticle structure, either covalent methods or a physical absorption method, that you can have them delivered at the tumors more efficiently. By considering all these three type of unique phenomena that you apply while you are making the nanoparticle, that will determine so how the biological properties of these nanoparticles, whether they do have a more interaction with the serum proteins or more plasma concentration availability, or whether they have a more tumor versus all other organ delivery ratio, so that you can determine which particle formulation or which type of chemical composition is much better, either whether we want to use a targeted moiety or not. So all these unique features of the nanoparticle determines its utility. So remember that not always too much of chemistry or too much of modification on the nanoparticles not always will lead a better formulation. On the other hand, all these chemistries may not yield improved therapeutic benefit. So therefore, one need to keep in mind that if we make any simple formulation that is enhancing its bioavailability and targetability is the key factor. And you can also choose any specific ligand that is highly specific but not going to go to other organs. So considering all these factors, then we can determine what type of particles you want to choose. And as I said before, the particle size range chart, like as I mentioned, of 1 to 10 nanometer, they have dendrimers or good nanoparticles. They have a different clearance mechanism. And also when you make a nanoparticle formulation, between 10 to 200 or 220 nanometer, they obey the EPR mechanism. So if you want to seek help of nanoparticle technology, if you can make these nanoparticle size range in terms of like in between 10 to 200 nanometer, it would be easier that you can apply for EPR mechanism based delivery. If you make it very smaller, they will be cleared by biliary or maybe renal clearance 1 to 10 nanometer. And at the same time, it should not be too much positive, so therefore they will be toxic. On the other hand, the solubility is again a key factor. If you have low solubility, again they precipitate and no longer is going to be useful. So considering many of these characteristics, right from very simple iron oxide based and also doxyl formulation, it's liposomal formulation. They started, and then many paclitaxel based nano formulation based on polymeric micelle. And lately, you can see Abraxane is very widely used and approved by almost all countries to deliver paclitaxel using just a simple human serum albumin bound or cross-linked nanoparticle formulation. So considering all these, and then there are more and more targeted based nano formulations are still under evaluation, but so far more than 100 nanoparticle based formulations are in the clinic for cancer therapeutic application. And also you can see nowadays many microparticle based, even painkillers are exist, that you can take advantage of either quick release or a targeted pain delivery. This again talk about the schematic, how the nanotechnology evolved right from liposomal based doxyl formulation until a recent formulation that is called bind formulation. Bind formulation, you all might be knowing that recently bind formulation creator, he is from MIT. His name is Bob Langer. He's a great professor and who is behind Moderna COVID vaccines here in the United States. So he's a faculty with more than even close to 500 patents in his credit. He was the one, he developed so many number of particle formulations, and then he was the one behind mRNA based vaccines on the Moderna COVID vaccine. And he was the one developed these bind nanoparticles, but unfortunately in the clinical trial it didn't do well compared to the currently existing docetaxel formulation. This bind formulation is a docetaxel PLGA-based nanoparticle formulation, which contained a PSMA targeted delivery-based formulation. So considering all these basic, idea and the knowledge and engineering of various nanoparticle formulation, since I have been trained in material science and polymer technology, and I took training from Cleveland Clinic and UNMC Nebraska, and also from Sanford Research, where I learned medicinal applications of various nanoparticles, and therefore I have been widely involved and I've been using my nanoparticle technology in cancer therapeutics and lately HIV and various other therapeutic indications. And simply we asked in the beginning what type of particles we want to use. We just made like 6 different type of particles. Here you can see curcumin, cyclodextrin formulation, PLGA, cellulose based, dendromer based, and magnetic nanoparticle based. And we characterize them well, we using various, physicochemical methods, and did some of the biological assays, and we confirmed that even if you use same therapeutic molecule, you put them inside the nanoparticles, various type, and you see different therapeutic activity. And here we see greater activity when we combine with magnetic nanoparticles. So therefore, we went ahead and then formulated and patented a magnetic nanoparticle formulation. We applied for breast cancer, prostate cancer, and pancreatic cancer. The same formulation, either you use nanoparticles for the curcumin to clinical drugs such as gemcitabine, docetaxel, paclitaxel, and we have been applying, in conjunction with MRI contrast agent and also CT contrast agent. These we can apply for various indications. As I mentioned before, if you can choose any targeted moiety that proteins that exist on the tumor cells, you can deliver more efficaciously if you take any of those against antibodies. So here we proved a basic concept of using PSMA antibody, that this protein PSMA is widely expressed in prostate cancer or prostate tumors. The literature suggests almost 100% of the tumors they express PSMA antibody. So therefore, we tried PSMA antibody-based PLGA nanoparticles, and we see its greater targetability and residence of these targeted delivery of the curcumin molecule towards the tumor cells, and also to the tumors in the mouse, and also on the ex vivo tumor, human tumor xenograft, and also some of the TMS. And this is the whole data that is targeting how efficaciously we can target these tumor cells. On the other hand, we also asked how we can deliver these same technology, but you apply magnetic nanoparticles. So we took same concept of PSMA targeted delivery, but also we want to introduce some of the MRI capability to the same formulation, and then we did use PSMA on the top so that we can more efficaciously deliver the tumor cells both in the tumors and also in the cell culture. So how about we use any microRNA or any other biomacromolecules using the same nanoparticle formulation that we developed? So this data clearly suggests that we can still able to deliver more efficiently microRNAs, because those are, if you deliver them as such, these microRNAs, they won't be able to go inside the cells unless you use some type of agent that can deliver these microRNAs. Either you need to use transfection reagent, or maybe you use some of the electric pulse so that they can generate pores. Therefore, these microRNAs can be delivered. So here we used our own nanotechnology that we can efficiently use these microRNAs. Again, this data, entire data in prostate cancer cells and also in prostate cancer tumors. The tumor data is not here, but we have with us that showed a greater amount of better therapeutic benefit with this microRNA delivery. And how about we use any simple self-targeting nanoparticle-based method? So meaning that rather than choosing any specific antibody, we selected a few cellular membranes of some of these cells, like called neutrophils mesenchymal cells, Jurkat cells, and raw cells. Assuming that these cells have tendency and can recruit at the tumor site. And we compared these extracted membranes from these cells, and then we put it on our own nanoparticle based method, and then we screened number of formulations based on this, and we tested both cell culture and tumor targeting, and we end up having one type of formulation is better, therefore that can be applied for tumor targeted delivery. Similarly, we can use same self-assembly technology to deliver docetaxel or any other chemosensitizing agent so that you can tackle about drug delivery aspect. Or drug resistant, that these tumors can be respond more efficiently. And again, this nanotechnology can also be applied for dual drug delivery, gemcitabine curcumin or gemcitabine gambogic acid or gemcitabine or EGCG, or you name any chemo sensitizer along with the main chemotherapeutic agent. So here you see the greater synergy that you can achieve the combination of two or more drugs within one type of formulation. Alternatively, you can also choose two different nanoparticle-based drug delivery agents simultaneously can deliver to achieve a better and meaningful synergy with the nanoparticles. So here another example showing if you use any simple targeting of macrophages using our nanoparticle, they can facilitate tumor targeted delivery because many of the TMAs, tumor associated TA or tumor associated macrophages, are exist within the tumor microenvironment. That is another way of efficiently that we can deliver the therapeutic agents using nanotechnology. Not only that, we can also aim to deliver more efficaciously to the bone when you choose a specific zoledronic acid on the nanoparticle surface so that that can be draw these nanoparticles more efficiently towards the bone wherever you see ZA has more tendency to go and bind to the bones. So that way, so that you can improve the bone targeted delivery. So these are some of the examples that we come across how we can improve the more delivery purposes. And whereas there are some failure stories also exist. You think that all the nanoparticle formulation always great and they can give you a better outcome. It's not necessary that the first FDA approved FedEx formulation aimed for liver imaging, it has been recalled because of stability issue over a period of time. So that means as I mentioned before, the stability is key to use for any nanotechnology application, at least in terms of biological application. So here it is, the cancer is most widely used, you must have a better stability. As I mentioned before, too much of chemistry always not going to lead a better outcome. Here the example is bind nanoparticle formulation where you have a PSMA targeting, but at the end they didn't find any better therapeutic payload delivery at the tumor cells compared to their other type of formulations. And this is another formulation how the too much of chemistry not going to be helpful. This is the Kala 01 formulation. Considering all these and also right from collecting through the literature, you see various type of formulations majorly liposomes, polymeric micelles, or polymeric nanoparticles, or metal-based nanoparticles, they can be applied in terms of delivery or in terms of designs or in terms of imaging purpose. But altogether, liposomes are obey all type of physicochemical properties. Therefore, they can be applied for all type of delivery purpose. Right from small molecule to biological macromolecule. So therefore, you might heard that all mRNA vaccines that are exist, or at least in the United States, both from Johnson and Johnson, and also for Moderna, and also from the Pfizer, they're all based on liposomal based formulations, so that anyone can be easily can choose a liposomal formulation. Apart from that, there are more unique features also exist with the polymeric micelles and polymeric nanoparticles and also metal-based nanoparticles when you choose for detection or also for the delivery purposes. So, in one word, like you need to choose, pick and choose for your right given application.